What I'm about to show you could be the difference between celebrating your 75th birthday and spending it in a hospital bed. And when I show you the exact blood pressure numbers that are silently destroying your arteries right now, as you sit in your favorite chair watching this video, you're going to feel a chill run down your spine. I'm Dr. Emily Richardson, and if you're over 60 and haven't had this conversation with your doctor, you need to watch every single second. Subscribe to this channel right now because I'm going to share information your doctor probably doesn't have time to tell you, information that could save your life. Let me ask you something. Do you know your blood pressure numbers? Not roughly, not approximately, but exactly. The top number and the bottom number sitting in your medical records right now. If you can't answer that question immediately, you're already in more danger than you realize. Because here's what keeps me up at night as a cardiologist practicing in Chicago for over 2 decades. Millions of seniors are walking around with blood pressure numbers that are quietly destroying their cardiovascular system, and they have absolutely no idea. No symptoms, no warnings, nothing. Just a ticking time bomb inside their chest. By the end of this video, you're going to know the exact blood pressure range that keeps your heart healthy as you age. You're going to know which numbers mean you need to act immediately, and you're going to understand why the standard guidelines you've been following might actually be putting you at risk. Stay with me, because what happens in the next 12 minutes could quite literally save your life. Let me tell you about Harold first, because his story is going to illustrate exactly how dangerous this silent killer can be. Harold was 68 years old, living in Tampa, Florida, a retired postal worker who prided himself on being healthy. He walked 2 miles every morning, ate what he thought was a balanced diet, and felt fantastic. No health complaints, no symptoms, nothing. His doctor had told him years ago that his blood pressure was a little high, but nothing to worry about, so Harold didn't worry about it. He never checked it at home, never thought about it again. Then one Tuesday morning in March, Harold woke up and couldn't move the right side of his body. His wife called 911. He ended up at Tampa General Hospital where I was consulting that week. Massive stroke, the kind that changes your entire family's life forever. Harold spent 4 months in rehabilitation learning how to walk again, how to speak again. And here's what makes this absolutely devastating. When we looked back at Harold's records, we found that his blood pressure had been 158/94 at his last checkup. For 3 years straight, that number had been sitting there, ignored, untreated. The stroke was not random. It was the predictable result of uncontrolled hypertension that nobody had addressed. But here's what nobody tells you about blood pressure and aging. The ranges that doctors consider acceptable change as you get older. And some of those guidelines, particularly the ones from just a few years ago, are now being challenged by newer research. Your normal blood pressure at 65 might not be the same as your normal at 75. Understanding this difference is absolutely critical. Let me explain what blood pressure actually means, because I meet so many patients who nod when I talk about numbers but don't really understand what they're seeing. When you get your blood pressure taken, you get 2 numbers. The top number is called systolic pressure. This measures the pressure in your arteries when your heart beats, when it's actively pumping blood out. The bottom number is called diastolic pressure. This measures the pressure in your arteries between beats, when your heart is resting. Both numbers matter, but they tell you different things. A blood pressure reading of 120/80 means your systolic is 120, your diastolic is 80. The units are millimeters of mercury, which you'll sometimes see written as millimeters of mercury. Now, here's where things get confusing and where a lot of seniors get hurt. For decades, the standard guidelines told us that a blood pressure under 140/90 was fine. If you were under 140 systolic and under 90 diastolic, you were good. But research has evolved, and the new guidelines tell a very different story. In 2017, the American Heart Association and the American College of Cardiology updated their blood pressure guidelines, and the changes were significant. They lowered the threshold for what constitutes high blood pressure from 140/90 down to 130/80. This single change reclassified tens of millions of Americans as having high blood pressure who previously thought they were fine. And for seniors, this was particularly important. Now let me break down the specific ranges you need to know. This is the framework I'm going to give you today, and I want you to remember these numbers. They're going to be the foundation of everything we talk about. Normal blood pressure is less than 120 systolic and less than 80 diastolic. That's the ideal range, the range where your cardiovascular system experiences the least stress, where your arteries stay healthiest, where your risk of stroke and heart attack is at its lowest. Elevated blood pressure is systolic between 120 and 129, with diastolic less than 80. This is the warning zone. You're not in the danger zone yet, but you're heading there fast. Your blood pressure is climbing, and without intervention, you'll likely be in the high blood pressure category within a few years. High blood pressure, also called hypertension, is then divided into two stages. Stage 1 hypertension is systolic between 130 and 139, or diastolic between 80 and 89. Stage 2 hypertension is systolic 140 or higher, or diastolic 90 or higher, and then there's hypertensive crisis, which is systolic over 180 and or diastolic over 120, and this requires immediate medical attention. Now here's what I need you to understand about these numbers as they relate to seniors specifically. The older you get, the more dangerous even moderately elevated blood pressure becomes. This is because your arteries naturally become stiffer with age. They lose their elasticity. This process is called arterial stiffening, and it's a normal part of aging. But when you combine arterial stiffening with high blood pressure, you get a double blow to your cardiovascular system. Your stiff arteries can't expand and contract properly to absorb the pressure waves from your heartbeat. And high blood pressure forces those stiff arteries to endure more stress than they were designed to handle. The result? Increased risk of stroke, heart attack, heart failure, kidney disease, cognitive decline, and dementia. All of these complications are directly linked to uncontrolled high blood pressure in seniors. But here's the part that really concerns me, and this is something I need you to really hear. For a long time, there was a belief that higher blood pressure in seniors was acceptable, even normal. The reasoning was that as you age, your blood pressure naturally increases, and trying to lower it too much in elderly patients could actually be harmful. Some doctors believed that lower blood pressure might reduce blood flow to your brain and cause problems. This belief has been largely debunked by modern research, but it still influences care in some settings. I've seen patients in their late 70s and early 80s whose doctors told them not to worry about blood pressure readings of 150 over 90 because it's normal for your age. That is dangerous thinking. That is outdated thinking. And that thinking leads to strokes like Harold's. Let me tell you about Martha, because her story illustrates exactly why this matters so much for seniors. Martha was 76 years old, living in a retirement community in Scottsdale, Arizona. She'd been active her whole life, played golf 3 times a week, traveled with her husband, and was overall in pretty good health. But her blood pressure had always run a little high, around 145 over 88, not dangerous, but definitely elevated. Her doctor had been monitoring it for years and had never recommended medication. "It's fine for your age, Martha. Just watch the salt." So she watched the salt. She didn't stress about it. She figured if the doctor wasn't worried, she shouldn't be worried either. Then one afternoon, Martha started feeling confused. She couldn't find the right words to say. Her husband noticed that her face looked different. One side seemed to droop slightly. He recognized the signs because his own father had had a stroke. He called 911 immediately. Martha made it to the hospital in time, and the stroke was relatively mild, but it changed her life. She spent months in therapy. She couldn't play golf anymore, at least not the way she used to. Her independence, which she'd always taken for granted, was suddenly fragile. When we analyzed Martha's case, it was clear. Her blood pressure, those elevated numbers that everyone had dismissed as acceptable for her age, had been quietly damaging the small blood vessels in her brain for years. The stroke wasn't random bad luck. It was the predictable consequence of years of uncontrolled blood pressure in an aging brain. Now, I want to be very clear about something. Not every case of high blood pressure leads to a stroke or heart attack. Many people with elevated blood pressure live long lives without major complications. But the odds are not in your favor. The research is unambiguous. Every 20 millimeter increase in systolic blood pressure doubles your risk of stroke. Every 10 millimeter increase in diastolic blood pressure doubles your risk of heart attack. These aren't my opinions. These are established facts from decades of medical research. So what is the best blood pressure range for seniors? The answer, based on current evidence, is that the ideal range for most seniors is the same as for younger adults. Less than 120 systolic and less than 80 diastolic. That's the sweet spot. That's where your cardiovascular system experiences minimal stress, where your arteries stay healthiest, where your brain gets the blood flow it needs to function properly for decades to come. But I also need to be honest with you about something. There's a nuance here that matters enormously for seniors. In some cases, particularly for very elderly patients over 80 or for those with certain health conditions, a slightly higher target might be appropriate. This is called personalized medicine, and it means that your ideal blood pressure isn't just a number on a chart. It's a number that takes into account your overall health, your other medical conditions, your risk of falls, your cognitive function, and your quality of life. For most seniors between 60 and 80, I aim for a target of less than 130 over 80. This is more aggressive than the old guidelines, but it's based on solid research showing better outcomes at this level. For seniors over 80 who are generally healthy and functional, I often still target less than 130 over 80, though I'm a bit more conservative if they have other health challenges or a history of low blood pressure causing dizziness or falls. Let me show you what this looks like in practice. I want to give you a framework you can use to understand your own numbers and what they mean for you specifically. If your blood pressure is less than 120 over 80, you're in the normal range. Keep doing what you're doing. Maintain a healthy diet, stay physically active, manage stress, check your numbers periodically to make sure they stay in this range. If your blood pressure is 120 to 129 over less than 80, you're in the elevated range. This is your warning signal. You don't need medication yet, but you absolutely need to make changes. I recommend dietary changes, specifically the DASH diet, which has been proven to lower blood pressure. Increase your physical activity. Reduce sodium intake. Lose weight if you need to. And check your blood pressure monthly to make sure it doesn't continue climbing. If your blood pressure is 130 to 139 over 80 to 89, that's stage 1 hypertension. This is when I typically start discussing medication with my patients, particularly if they have other risk factors like diabetes, smoking history, high cholesterol, or a family history of heart disease. But medication isn't the only answer. Lifestyle changes remain critically important and can sometimes be as effective as medication in lowering blood pressure. If your blood pressure is 140 over 90 or higher, that's stage 2 hypertension. This requires treatment. In most cases, I'm recommending both medication and lifestyle changes. At this level, your risk of complications is significant enough that waiting and hoping it improves isn't appropriate. Once we identified the problem, we were able to treat it effectively. Robert started medication and made some lifestyle changes. His 24-hour blood pressure readings improved dramatically. And more importantly, we caught a serious problem before it caused a heart attack or stroke. Here's my point. If you only check your blood pressure at the doctor's office, you might be missing the bigger picture. Get a home monitor. Use it regularly. Share the results with your doctor. Now, I want to address something that comes up constantly in my practice. Patients ask me, Dr. Richardson, if my blood pressure is only slightly high, do I really need medication? Can I just try diet and exercise first? And my answer is always the same. It depends, and here's how we figure out what makes sense for you. For elevated blood pressure or stage 1 hypertension without other major risk factors, I absolutely recommend trying lifestyle changes first. Give it 3 months. Make serious changes. The DASH diet, 150 minutes of moderate exercise per week, weight loss if you're overweight, sodium reduction, stress management. These changes can lower systolic blood pressure by 10 to 15 points or more. That's equivalent to a blood pressure medication. But here's what I need you to understand. Lifestyle changes only work if you actually make them. I can't tell you how many patients I've seen who say they're eating better and exercising more, but when we check their blood pressure 3 months later, it hasn't budged. When I dig deeper, I discover they made modest changes, but not the dramatic changes needed to move the needle. Be honest with yourself. Are you willing to dramatically change your diet? Not just cut back a little, but really change what you eat? Are you willing to exercise most days of the week for at least 30 minutes? Are you willing to significantly reduce your sodium intake, which means reading labels carefully, avoiding processed foods, not adding salt to your food? If the answer is yes, then lifestyle changes might be enough. If the answer is no, or if you're only willing to make modest changes, then medication is probably the right choice. And for stage 2 hypertension, or stage 1 hypertension with significant other risk factors, I almost always recommend starting medication along with lifestyle changes. Don't wait. The damage from years of elevated blood pressure accumulates. Every month of uncontrolled hypertension does more harm to your arteries, your heart, your brain. Before I go any further, I need you to subscribe to this channel. I'm Dr. Emily Richardson, and my mission is to give you science-backed health information that your doctor might not have time to explain, information that could change your life. Hit that subscribe button and join hundreds of thousands of seniors who are learning how to protect their health every single day. What I'm about to share with you next is critically important, so stay with me. One of the most common questions I get from my senior patients is, what's the danger if my bottom number is high? Or alternatively, I only have a problem with the top number. Is that really that bad? Let me address both of these questions because understanding this matters. Your systolic blood pressure, the top number, reflects the pressure in your arteries when your heart is contracting. It tends to increase with age because your arteries become stiffer and can't expand as easily to absorb the pressure wave. Systolic hypertension is extremely common in seniors. About 80% of people over 65 with high blood pressure have isolated systolic hypertension, meaning their top number is high, but their bottom number is normal or even low. Isolated systolic hypertension is not benign. It's a major risk factor for stroke, heart failure, and kidney disease. When your systolic pressure is elevated, your heart has to work harder to pump blood through stiff arteries. Over time, this causes the heart muscle to thicken, which can lead to heart failure. It also increases the stress on blood vessels throughout your body, including the small, fragile vessels in your brain. But here's what's equally concerning. When your bottom number, the diastolic pressure, is elevated, that's also dangerous, just in a different way. Diastolic pressure reflects the pressure in your arteries between heartbeats when your heart is resting. If your diastolic pressure is high, it means your arteries are constricted even when your heart isn't actively pumping. This forces your heart to work harder even during the resting phase of each heartbeat. Elevated diastolic pressure in younger people is often a sign of early hypertension that will eventually lead to elevated systolic pressure as they age. In seniors, isolated diastolic hypertension is less common than isolated systolic, but it still occurs and still needs treatment. The reality is that both numbers matter. You can't look at one and ignore the other, and the ideal scenario is to have both numbers in the normal range, less than 120/80. That should be your goal. The lesson here is that treating blood pressure in seniors requires nuance. We can't just apply the same approach we use for younger patients. We have to consider the whole picture, including the relationship between the two numbers, the risk of falls, the possibility of overtreatment, and the individual patient's overall health and life expectancy. Now, let me talk about something that terrifies me as a cardiologist, and that's the early morning blood pressure surge. This is a phenomenon where blood pressure rises sharply in the early morning hours, typically between 4 and 8 a.m. This surge is a normal part of the circadian rhythm. Your body produces hormones in the morning that increase heart rate and blood pressure to help you wake up and start your day. But in some people, this surge is exaggerated. The morning blood pressure spike is much larger than it should be, and this is exactly when most heart attacks and strokes occur. The early morning hours, between 4 and 8 a.m., are the highest risk period for cardiovascular events. This is why I always tell my patients to check their blood pressure first thing in the morning, before they've taken any medication, before they've had coffee, before they've done anything else. That morning reading tells us a lot about your cardiovascular risk. If your morning blood pressure is significantly higher than your evening reading, or if it's consistently in the hypertension range, even though your daytime readings look okay, you might be experiencing an exaggerated early morning surge. This is a serious risk factor that needs to be addressed. How do we address it? First, by measuring. You need home monitoring to catch this. Second, by timing your medication appropriately. If you're on blood pressure medication that only lasts 24 hours, taking it first thing in the morning might not protect you during that early morning surge. Some patients do better taking their medication at night, so the peak effect coincides with the morning surge. But this is something you need to discuss with your doctor. Don't change when you take your medication without guidance. Third, by making sure your evening routine doesn't contribute to the problem. Going to bed with high blood pressure, eating a large meal late at night, drinking alcohol, all of these can affect your morning blood pressure readings. Let me tell you about Charles, 73, from Columbus, Ohio. Charles had excellent blood pressure control during the day. His readings were consistently around 128/78. But he was having strokes, small, silent strokes that were being picked up on his MRI scans. These strokes were causing cognitive decline, memory problems, personality changes. Charles was slowly losing himself, and nobody could figure out why. I suspected morning blood pressure surges, so I asked Charles to do morning home monitoring for a week. Every morning, before medication, before getting out of bed, he checked his blood pressure and logged it. The results were shocking. His morning readings were consistently 158/94, much higher than his daytime numbers. He was having massive morning surges that were damaging the small blood vessels in his brain every single day. We adjusted his treatment. We switched him to a longer-acting medication taken at night. We added a second medication specifically to address the morning surge. And we changed his evening routine. He stopped eating after 7 p.m., stopped drinking alcohol after dinner, and started taking a magnesium supplement at bedtime that helped him relax and kept his blood pressure lower overnight. 3 months later, Charles's morning blood pressure was 132/80. Still not perfect, but dramatically improved. And follow-up MRI scans showed no new silent strokes. We stopped the damage. This is why knowing your morning blood pressure matters. This is why checking your numbers at home matters. This is why understanding the nuance of blood pressure management for seniors matters. Now, let me talk about one more thing that I think is really important for seniors to understand, and that's the connection between blood pressure and brain health. High blood pressure in midlife is one of the strongest risk factors for dementia later in life. This includes both vascular dementia and Alzheimer's disease. When you have high blood pressure, you damage the small blood vessels in your brain. These tiny vessels are responsible for delivering oxygen and nutrients to brain cells. When they're damaged by years of elevated blood pressure, brain cells die. This shows up over time as cognitive decline, memory problems, difficulty thinking clearly. I've seen this in my own practice. Patients in their 70s and 80s who can't remember their children's names, who get lost in their own neighborhoods, who can't manage their finances anymore. And when we look at their brain scans, we see evidence of small strokes, of damaged blood vessels, of the accumulated damage from years of uncontrolled blood pressure. This is why I sometimes get a little more aggressive with blood pressure treatment in my patients who show early signs of cognitive decline. Protecting the brain is just as important as protecting the heart. So here's your action plan. Right now, today, this very moment, I want you to do the following things. First, find out your blood pressure numbers. If you don't know them, call your doctor and ask. Or go to a pharmacy and use the blood pressure machine. Or buy a home monitor and check it yourself. Whatever it takes, find out your numbers. Second, write them down. Track them over time. Check them regularly. Morning, evening, whenever you can. Third, understand what those numbers mean using the framework I gave you today. Normal, elevated, stage 1, or stage 2. Know where you stand. Fourth, make a plan with your doctor to get your blood pressure into a healthy range. If it's elevated or stage 1, you might start with lifestyle changes. If it's stage 2, you'll likely need medication. Follow the plan. Be consistent. Be patient. Fifth, keep monitoring and adjusting. Your blood pressure management is an ongoing process. Stay vigilant. Now, if this video has been valuable to you, I need 3 things from you. First, subscribe to this channel. I'm Dr. Emily Richardson, and I bring you science-backed health information every single week. Information your doctor might not have time to explain. Information that could change your life. Second, share this video. Send it to your family, your friends, anyone you know who is over 60 and might not know their blood pressure numbers. This information could prevent a stroke. It could save a life. Third, leave a comment below. Tell me what your blood pressure numbers are. Tell me if this video helped you understand them better. I read every single comment, and I love hearing from you. Your blood pressure is one of the most important numbers in your life. It predicts your future. It tells the story of your cardiovascular health. It tells you whether you're on track to live a long, healthy, independent life, or whether you're heading toward a stroke, a heart attack, dementia. This is serious. This matters. Take control of your numbers. Take control of your health. Make the changes you need to make. And I'll see you in the next video. Take care of your heart. Take care of your blood pressure. And take care of yourself.